Good afternoon, everyone, and welcome to TOCOIndia TOCO, an online lecture series on tobacco control in India. My name is Sanchita Roy Pradhan. I, along with my colleague, Ms. Sagrika Raut, will be your host for today's session. The topic of today's webinar is burden of BD consumption in India, and it is our honor to introduce our speaker, Dr. Yogesh Kumar Jain, and I'm sure that many of you may already be familiar with Sir's remarkable achievements and contribution in the field of tobacco control. Dr. Jain currently serves as the project manager for the BI project at the School of Public Health, AIIMS, Jodhpur. With over 8 years of experience in public health, teaching and research, Dr. Jain has made significant contribution to the field. He is an esteemed IGTC scholar in global tobacco control leadership from Johns Hopkins Bloomberg School of Public Health and a global health EDGH scholar from the University of Washington. His expertise is further recognized through his role as an editorial board member of both PLOS One Journal and the International Journal of Public Health Science. Dr. Jain has played a pivotal role in the national reports addressing the health, environmental, and economic burdens of tobacco, collaborating with the World Health Organization on ICO implementation, and contributing to the Common Review Mission report with the NHSRC, Ministry of Health and Family Welfare. With an impressive portfolio that includes more than 38 peer-reviewed publications and book chapters, his research interests focus on global health, tobacco control, and health economics. Please join me in giving the warmest of welcome to our esteemed guest. Now, without further delay, I will request Dr. Yogesh Kumar sir, can you proceed with the session?
Thank you, ma'am. I think there was network issue. Audible?
Sir, you are audible.
All right, so
Sir, you can turn off your video and see.
just a second. Yep. So I hope my slides are visible. So
Yes, sir.
thank you for such a generous and to Yogesh, representing School of Public Health from AIIMS Jodhpur. Please let me. There might be some internet-related issues. So if my voice is lagging or breaking, please feel free to address an important area of tobacco control, that is BD, relatively lower prioritized segment of tobacco control, as well as and in the minds of so before directly jumping in hazardous substance, BD comes with a misleading perception. It is marketed with a being harmless as well as a safer alternative to conventional, because it is grown and rolled in industries and it is wrapped in a tendupatta leaf. It is associated with the overall
Sir, sorry to interrupt.
Of being organic, herbal. Sorry.
Yeah, sir, actually your voice is breaking. So what we can do, if you can share your PPT with us, we can display the PPT from our end, and you can, because
sure. Just a second. I made it to you then. Yes, I've emailed it to you, ma'am. If you could please check and let me know.
Yes, yes.
It's great.
Yes, sir.
Yeah. If you could please take to the next slide.
Yeah.
Yeah. All right. So as I was saying earlier, BD is seldom marketed with a misleading perception of it being organic, harmless, and a safer alternative to conventional tobacco products. Uh, it being rolled in a tendupatta leaf, it often symbolizes a herbal nature inherently, which is very much misleading. Again, this misleading perception is not only amongst the eyes of the end users, but also amongst the eyes of the top tier policy makers, especially, which leads it to being less taxed and often subsidized as an industry. The resulting cheaper pricing is lucrative, makes it lucrative to the vulnerable populations, such as the young as well as the poor. Again, because of less stringent enforcement, poor health warnings are visible on BD product packaging. There may be no health warnings altogether, or the health warnings which are there, even if they are updated, they are often fuzzy, hazy, blurry. We are not able to make out even if it is some sort of a health warning or not. So this makes it lucrative to vulnerable population and leads to its easy access and early initiation to the world of tobacco addiction. Another thing is cultural acceptance. It is often offered as a social offering in cultural events, social events in many segments of the society, and it is marketed as poor man's pleasure. This poor man's pleasure renders the unprivileged exposed to the hazard, the health burden due to BD, and those poor people are seldom not able to take medical help because of the diseases that have occurred because of this poor man's pleasure to begin. All of these together makes it the second most consumed form of tobacco in the country, just after smokeless tobacco, and with a very high prevalence even in context to cigarettes. The industry, if this was all not enough, the industry comes up with alternative counter narratives of providing livelihood and employment opportunities to the lacks of people who are employed in BD rolling as a profession. So the industry, whenever there's some policy regulation that is about to encompass around BD industry, they always give this view that we are providing so much revenue in form of taxation, we are providing so much livelihood opportunities, employment opportunities, and lakhs of people run their home because of us. If you make it even more regulated, if you make it more stringent, this will cause loss of livelihood for lakhs of people who are engaged with us, whom we are employing. Next slide, please. Yeah. Next one, please. Yeah, this one. All right. So before understanding the burden due to BD consumption, I would like to quickly take you through the BD treat life cycle. BD is a small in size, seemingly benign appearing product, and it appears that it carries very less health burden, but the evidence is contrary. It poses a significant health risk amongst all of its users, and not just the users, all of those who are involved in manufacturing the life cycle of BD, right from the tobacco cultivators to those who are plucking tendupatta from forests, the BD rollers, as well as the end users. Tobacco cultivation, BD tobacco cultivation, and tobacco cultivation in general is a predominantly pesticide intensive farming practice. Now, these pesticides not only endanger the human health, it leaches out toxins and heavy metals into the soil as well as the nearby marine networks. Tendupatta is plugged from forests, and it is known to be associated, well documented to be associated with many forms of sexual harassment as well as accidents such as snake bites. BD rollers, they use with tobacco in tendupatta without proper safety equipments, and the nicotine gets absorbed through skin. Tobacco dust get inhaled directly into their lungs and is known to cause all sorts of health injuries to BD rollers as well. It is estimated that 60,000 crores to 1 lakh crore BD sticks are produced annually every single year in the country. And these 1 lakh crore BD sticks are responsible for at least 5.5 lakh annual deaths in the country for the end users alone, along with numerous health issues for BD rollers. Next slide, please. Yeah, so this is the entire BD trade life cycle. I would like to take you through this so that you get a glimpse of how extensive this industry is, how many people are actually engaged in this industry. The tobacco, BD tobacco specifically, grown in pockets of Karnataka and Gujarat and Andhra Pradesh, it it is cultivated and sun-dried by the farmers and then possessed by the manufacturers through representatives or agents. While on the other hand, the Tendu in which this tobacco is rolled, is bidded by the government, the Department of Forestry themselves. And this tender process is, after execution of these tender processes by the government, it comes to the BD manufacturers. Now, these BD manufacturers provide all these raw material to the middlemen or the munshis who takes it to BD rollers. Now, after BD rolling is completed, those munshis again come back and collect those BD sticks. They do all sorts of negotiations that this BD stick is not properly made, this BD stick is not properly rolled, and all those things. And nearly 30 to 35% sticks are rejected there and then. But the interesting part is those 30 to 35% sticks are not taken off the circulation. They go into illicit circulation. And even after the hard work and labor of those BD rollers, they are not paid for it. Thereafter, the sticks goes into sorting and packaging and all those things through the manufacturer and reach the end user through wholesalers and retailers. This is the entire cycle of how BD is manufactured in the country. Next slide, please. Yeah. So this entire thing takes up to 141,000 hectares of land in India. 264,000 tons of BD tobacco, not tobacco in general, just BD tobacco. 264,000 tons of BD tobacco is cultivated in India using 141,000 hectares of land in a country where there's so much food scarcity. It is often said that we don't have enough land to feed our indigenous people. These 5 million standard bags of tendu patta that are being plucked from the forest. 5 million, one individual bag contains around 50 to 70,000 tons, 50 to 70,000 leaves in each singular bag. These many leaves are plucked every year for making of these BD sticks. And again, these are associated with forest fires. Once the tendu patta are being plucked from the forest, they themselves light the forest up just for sake of getting fresh produce in the next season. Now, these are again forest fires. They are not controlled. No one can control them. These extend to the other parts of the forest, causing loss of local flora as well as fauna, and also contributing to global warming extensively. Next slide, please. Yeah. So the BD manufacturing process, again, this is all that we talked about till now was the raw material part. Now we come to the manufacturing process. It is a labor-intensive process, involves a lot of small-scale home-based women and children. And the tobacco remains largely unregulated. Tendupatta is okay, it is being bidded by the forest departments and auctioneers. There might be some illicit thing going on over there, but biri tobacco in general remains largely unregulated with its production and marketing part, which is controlled by the private sector. Manufacturers acquire the raw material through bidding process and transport them through the middlemen to the BD rollers, which often involves females and children in informal settings with poor working conditions. No occupational safety measures are being provided over there. They're exposed to tobacco dust, they're exposed to nicotine, and there are at least 50 lakh laborers, such laborers who are living in the country as of today. At least I've used this word because these are the registered laborers. There are a whole lot of unregistered workers who are engaged in BD rolling, who do not even get basic health rights, basic pension benefits, basic medical benefits, which are mandated by the government, and thus face legal violations of their basic human rights. Next slide, please. Thereafter, these manufactured packed BD sticks are distributed through retailers, wholesalers, and street vendors. And again, there is a high participation of informal sector. It is largely unregulated. It leads to a lot of illicit cross-border trade, duty exemptions because of the unregulated nature of the industry, and the BD sticks, which are finally in the very least, which are taxed. They are taxed at merely 22% because of the industry being considered as a Swadesi or a local cottage industry. For comparison, cigarettes are taxed at 58%. Smokeless tobacco is taxed at 64%, while BD sticks are taxed at 22%. We need to understand this. It is very important because there is, on one hand, one product which is causing so much health hazard, so much economic hazard, so much environmental pollution, and it is not at all, only 20.6% of this entire industry is actually contributing to the government exchequer or the government revenue. Even after that, the industries are provided with tax subsidies and exemptions. A harmful product, an addictive product, which is being offered tax subsidies till the annual turnover reaches 40 lakh rupees annually. Legal violations in form of pictorial health warnings. There are many forms of counterfeit products, flavored tobacco products, flavored BD products to say, and promotions, the violation of pack warning norms, as you can see in the images that I've attached. Either the health warnings are not visible at all, or even if they are so blurry or so mismanagedly placed that you are not able to figure them out, whether these are like some sort of a health warning, even if it is a health warning or not. Next slide, please. Yeah. So BDs, although there are pockets in India, such as Haryana and all those states where it is being consumed by the higher income strata as well, but predominantly it is being consumed by the low income groups because of affordability. And this affordability again is because of the low taxation, low regulation. In India, there is a 7.7% prevalence of BD consumption, and this 7.7% is daily smokers. These are daily smokers, 87 million adult males, 77 million specifically from rural areas, who are exposed to a variety of health risks such as cardiovascular diseases, respiratory diseases, cancer, COPD, TB, and all sorts. Next slide, please. Yeah. So coming into taking into consideration the trends of BD consumption in the country, right from GATS 1 to GATS 2, although BD consumption has indeed increased from 9.2% to 7.7%, but it is clearly evident that it is still far higher, far greater than the cigarette consumption prevalence in the country. As of now, in accordance with the last round of GATS that was conducted in 2017, cigarette consumption prevalence was 4% and BD consumption prevalence was 7.7%. If we look at the GYTS data, the prevalence has fallen from 2.2% to 2.1% in 4 rounds of GYTS. While because of our stringent efforts in tobacco control, and especially focusing upon cigarettes, the cigarette prevalence from amongst the youth of 13 to 15 years of age has fallen from 4.2% to 2.6%. The median age of initiation for BD lies at 10.5%. I urge you to just imagine about, keep thinking about your own children who are exposed to such a thing. This is a median age. People get initiated in single digit ages, 7 years, 8 years, 9 years. Thus, this median age of 10.5 years for exposure to BD consumption. And again, this is much lower than cigarette exposure. There are 7.2 crore BD smokers, active daily BD smokers in the country. Next slide, please. Now, one might definitely argue that BD consumption, it might not be that much harmful. Tobacco content is lesser, the stick is small. How can it be as harmful as cigarette consumption, which is filled to the brim with tobacco and such a long stick and all those things? But I would like to argue with that using the narrative that the nicotine concentration, the carbon monoxide concentration that is delivered after smoking BD is far higher as compared to cigarettes. Now, again, don't take me wrong. I am not advocating that cigarettes are safer. Cigarettes are very much harmful. BDs are more or at least equally harmful as cigarettes. We can see that cigarettes are wrapped in virgin paper, which do not have a tendency to self-extinguish. But on the other hand, BD tobacco is wrapped in tendu leaf. It is non-porous in nature. It has a higher moisture content than a paper. And it has got a tendency to self-extinguish, which makes the user drag it with much more intensity, with shorter interpuff durations or more frequency. Because of such higher puff intensities and shorter interpuff durations, studies have proven that BD smoking delivers around 1.3 to 1.4 times more carbon monoxide and nicotine as compared to cigarettes. Next slide, please. This higher puff intensity, higher delivery of toxins in the body. Next slide, please, Sanchita ji. Yeah. This is associated with a greater odds of disease occurrence, various cardiovascular and respiratory diseases. Next, just click once, please. Yeah. So, because of heavy BD smoking, as compared to non-smokers or even cigarette smokers, there are higher odds of development of wheeze, cough, dyspnea, chest pain, and associated respiratory and cardiovascular symptoms. Next slide, please, and just click once again. Not this one, yeah. Again, FEV in the previous, yeah, this one. So again, FEV1 to FVC ratio is an indicator of our lungs' vital capacity. Those with a medical background might be well aware of this. And this dotted line on top is for the non-smokers, while the blue line at the bottom is for BD smokers. It shows how our vital capacities or lung capacities decrease over age as we smoke BD and other tobacco products. Next slide, please. Similarly, for cardiovascular events, respiratory events, and deaths, just click once, please. Yeah. So for cardiovascular, respiratory, and death mortality-related events, there are higher hazard ratios associated with BD smoking. Next slide, please. Yeah. So this is one of our studies which we had conducted in AIIMS Jodhpur back in 2021. BD alone are a cause of 5.5 lakh annual deaths. And this again is just because of 5 diseases that we had considered during that time: lung cancer, tuberculosis, oral cancer, ischemic heart disease, and COPD. If we were to consider an all-cause mortality, this number would be much, much higher. So just considering these 5 major diseases which occur due to BD consumption, BDs alone are responsible for 5.5 lakh annual deaths, that is, deaths in a single year in the country. 1.4 crore loss of disability adjusted life years, 1.3 crore premature loss of life years, and 13 lakh years that are lived with disability. Just in a minute or so, I'd like to explain all these parameters, the measures of mortality and morbidity for someone who might not be well versed with these. A person has died because of some disease. Now, he might have died before the normal life expectancy. Assuming a life expectancy of 75 years, a person has died because of BD consumption at 45 years. So there's a loss of 30 years. Those go under YLLs, premature loss of life years. And a person might not just drop dead one day after smoking BD. He might be suffering because of some or the other disease that has been he has contracted because of BD consumption. And because of that disease, he might not be able to live up to the full potential. He might not be able to contribute to his up to his 100% in his job and in the economy in general. Now, those years with limited productivity contribute to YLDs, years lived with disability. And this disability adjusted life year is a measure of morbidity, which is the summation of this YLL and YLD. So, equating this disability adjusted life years or loss of productivity to the country, we were able to achieve a number of 21.43 lakh crore rupees. Now, this 21.43 lakh crores is the annual productivity losses to the country, which is equivalent to 1.1% of the annual total GDP of India. This is again very much important, as we can say that annually the government is spending around 3 to 4% of its healthcare budget, 3 to 4% of its total budget on healthcare, while 1.1% is taken away from it because of BD consumption. The counter narratives of the BD industry that we give so much to the government exchequer, it is contradicted here, right here, that for every 1 rupee that the BD industry is depositing to the government exchequer, it takes away 8 rupees in form of disease burden. Next slide, please. Yeah. So to summarize it, 5.5 lakh annual deaths. These are numbers that we should be aware of. This is solely attributable to BD, not smoking, not cigarettes, not tobacco, just BDs. 5.5 lakh annual deaths, 1.5 crore annual deaths, 1.3 crore premature life years that are lost, and 21.4 lakh crores of potential economic losses solely attributable to BD consumption in India. Next slide, please. Could you please click once? When we go into the sub-national comparisons, morbidity, the states which are most affected due to BD consumption in terms of morbidity and mortality are Maharashtra, Tamil Nadu, and Uttar Pradesh. And again, when we look about the, please click once more, ma'am. And when we look about the economic component, Maharashtra, Tamil Nadu, and Gujarat are the worst hit states. These are the states which are most affected because of BD consumption. Next slide, please, ma'am. Yeah, so this is a comprehensive overview. Top 5 states with the most mortality associated with BD, Delhi's, virus, YLDs, loss of GDP, and percentage loss of state GDP. So you can have a quick look at it, and it is easily relatable that whether the state is located in the northern region, southern region, northeast, northwest, any region, you name it, and that state is very much affected in one way or the other because of BD consumption. Next slide, please. Yeah. So not just the health aspect, we have already covered the so much due to BD consumption.
Sir, you are not audible.
Water bodies to the consumption part where there is smoke first-hand smoke, second-hand smoke. Now there's even a concept of third-hand smoking, and the waste that is littered carelessly into the environment in form of BD butts and the packaging materials. Now, all these contribute enormously. In the next slide, we'll actually have a look at the huge quantities of waste that is being indiscriminately littered into the environment. But this environmental degradation starts right from the tobacco farming practices, and water, soil, air, all three are polluted with heavy metals and toxins. Those who are familiar with the concept of biomagnification might also be aware that this toxin level reaches up higher in the food chain and gets magnified with every with every accumulation in the food chain levels, and it affects marine life and finally the human health altogether. Another important part is global warming because of the forest fires for tendupatta as well as for tobacco curing. This is a major contributor of global warming in the country. Next slide, please. Yeah. So, to quantify how much environmental burden is being posed by BD consumption alone, there was another study that was conducted by iForest back in, I think, 2021. They have stated that the forest fires in the country are equivalent to an entire state of Goa. These such a large area of forest fires is solely because of BD production in the country. And taking aside the forest fires part, after consumption, the post-production packaging part that is discarded carelessly into the environment, which reaches the drains as well as ocean beds or the landfill areas, it is equivalent to 13.8 thousand tons. Again, 1 ton is 1,000 kilograms. So BD alone is responsible for 13.8 thousand tons of waste in India solely because of its post-production packaging. Now, one might definitely argue that a large chunk might be because of paper, which is biodegradable. No, it is not. If a paper is stuck to polythene or plastic, it is very hard to biodegrade by itself. And this plastic alone contributes 7.4 thousand tons of waste out of this 13.8 thousand. 54% of the waste from BD product packaging is because of non-biodegradable plastic. The cost of cleaning the drains as well as the collecting it and dumping it into the yards and all those associated ways of disposal, it again goes out of the pocket of us taxpayers. 39,000 tons are from filters. You might argue that BD does not use filters. No, it's not that simple. BD sticks, certain BD manufacturing brands also come with filters, and 39,000 tons per year contribution of waste is through filters. These filters contain even concentrated quantities of nicotine because these are already being sucked upon while consuming the BDs, and this again goes into marine and soil pollution. Next slide, please. Please click once more. Yeah. So this is a quick overview of if you would like a comparison of how cigarettes, BDs, and smokeless tobacco contribute to the annual national environmental burden. Northwest is the worst affected area in the country with 5,400,000 tons of waste per year, leading up to 13.8 thousand tons of waste. Next slide, please. If we look into the segregated areas, Haryana, you'll need to click one more for next 4 to 5 slides. Yeah. So Haryana is amongst the northern states of India. Haryana is worst affected. It is the tons of
Sir, you are not audible right now.
I think there's again some internet connectivity issue. On my screen, there's only North India being shown. Have you moved on from there?
Um, No.
Yeah, all right. Just click once more. All right. In the northwest, again, similarly, Uttar Pradesh is worst affected with 3,100,000 tons of waste being produced consumption annually. This is just a comparison that you get example.
Sir, we have lost you again.
Just a second, let me reconnect. All right, am I audible now? Sanchita ma'am, am I audible now?
Yes, yes, you're audible.
All right, if you could switch to the next slide. All right, so Eastern India, West Bengal, we can quickly jump through these. India again, West Bengal.
Sir, we are having some issues with the audio.
Have you changed the slides, ma'am? Next slide, if possible. Yeah, all right. We can jump through these. It's causing a lot of confusion. Next slide, please. Next, okay. Next. All right. So we have discussed the health burden on end users. We have discussed the environmental burden on the country as a whole and on the pockets of the taxpayers. Another thing that remains is the last narrative that the beauty industry provides, that we are providing livelihood opportunities, we are providing household, we are running so many households because of our industry. Those BD rollers, 50 lakh registered BD rollers, and many more who are not even registered in the country as of now, they are commonly documented with health disorders, be it nicotine toxicity because of the absorption through skin, be it respiratory disorders because of tobacco inhalation while rolling BDs, or musculoskeletal disorders because of their poor posture while rolling those BDs. Besides the health disorders, there are very many known cases of sexual assaults as well as violation of Juvenile Justice Act when people go to pluck tendupatta leaves in the forests, along with the hazards of animal attacks, snake bites, and all those things. Other than that, there are legal violations, child labor, just because of it being considered as a cottage industry. Children are employed, and there are no strict regulations if to manage that child labor in those particular pockets which are heavily involved in BD rolling. There are low wages. Imagine earning 78 rupees for rolling after rolling 1,000 sticks. And coming back to the earlier point, you must be rolling around 1,300 to 1,400 sticks to be even paid for 1,000 sticks. That 1,000 sticks are getting selected and you are being paid for it. And that amount is merely 78 rupees. Of course, it varies across various pockets of the country, but the lowest one is 78 rupees per 1,000 sticks. Non-provision of mandatory pension benefits, minimum wage benefits, medical benefits, and this non-provision, all those workers who are unregistered, who are not registered by the beauty industry, they are not getting any such benefits altogether. And even those who are registered, they are seldom denied such benefits. They must be having a card which is ensuring them some pension, but at the time of retirement or at the time when they go and seek the pension, there are known cases in which they are denied those benefits, be it healthcare benefit or mandatory pension benefit. Next slide, please. So summing all of these things up, next slide, please. No, there must be 2 more slides. Allow me to share the screen, just a second. I hope I'm visible.
Yes, sir.
All right. So summing all these things up, I'd like to quickly propose some way forwards. BD industry should be tackled, must be tackled if we want to succeed in our tobacco control efforts. If we leave out beer industry, it will develop a huge lacuna and a loophole in which other industries might find a way to wiggle out of. And the stringent regulation of BDs is much needed to stop them as acting as a friend group for tobacco industry. BD industries and BD products should be included in the mainstream implementation of COTPA. Various sections of COTPA, public smoking, Section 4, sale to minors, Section 6, pictorial health warning, Section 7. All those implementation of COTPA sections need to be considered while including BD products in the mainstream implementation. Enforcement drives, chalaning, all those things. In all those scenarios, BD must be considered while enforcing COTPA implementation. But along with this, there's another need to expand the existing cessation services. We cannot just stringently try to pull back BD industry while not helping the BD users who are addicted to it right from the age of 10.4 years. Expansion of existing cessation services, quit lines, popularization of quit lines for those who are engaged in BD consumption, and regulatory frameworks for the manufacturers. The subsidies and the less taxation, all these points need to be argued upon so that regulations should be stringently enforced on BD manufacturers. BD industry the counter narratives that are put forth by the BD industry must be recognized that these are misleading, these are not true. We have ample evidences, ample scientific literature to back our statements. So it should be recognized that the counter narratives of safety, livelihood opportunities, these are misleading. And there is a need of an improved surveillance at national as well as subnational levels to monitor BD-related diseases. There's a need of joint advocacy efforts. All those who are in this meeting might be working at different tiers. They may be at the ground level, they may be at the hospital level, they may be at the policy level. So there's a need of joint advocacy effort to first and foremost strip the cottage industry, the Swadeshi status of BD industry, considering the heavy toll on health, economy, as well as the environment. There's a need of recognition of BD rolling as an occupational health hazard to ensure that those people who are being falsely portrayed that hum inko mauka de rahe hain, we are giving livelihood opportunities to these people, this narrative should be countered in the very first step by recognizing BD rolling as an occupational health hazard, and only then will vocational rehabilitation measures be successfully implemented for all these workers to non-tobacco related livelihoods. There is a need of supply and demand check through stricter regulations ranging from production, distribution, sale, right up to marketing. And finally, once the cottage industry status is stripped off, only then will an increased taxation in line with other tobacco products, cigarettes, smokeless tobacco, and the FCTC recommendation value of 75%. This needs to be achieved through gradual annual assured increments in taxation, along with elimination of subsidies and exemptions. Such an industry should not be provided with manufacturing exemptions or industry-related exemptions just because it is a cottage industry. So with that, I would like to stop my presentation, and if there's any question, I would be happy to answer. Thank you.
Thank you so much, sir, for your wonderful presentation. And we are truly grateful for the invaluable knowledge and wisdom you have shared with us. So dear participants, we have now reached the question and answer session of today's webinar. I will encourage you to submit your questions to the chat box, and we will answer as many questions as possible within the time limit. So we haven't got any questions so far, actually. The way you have explained everything so well, I think whoever had any doubt, they have already cleared through your presentation. So I would again would like to request the participants, if anyone have any question, can kindly ask in the chat box. As we are not getting any question for today's session, so I think we are now calling it an end of our session. And we greatly appreciate Dr. Yogesh Kumar Jain sir's time and expertise to attend our webinar. Thank you so much for joining us today, sir.
Thank you, ma'am. Thank you for the opportunity.
So thank you all for joining us today, and I hope you found the webinar informative and helpful. And so finally, we'd also like to remind you that we have shared a feedback form in the chat box. So we'll be happy to get your feedback for the webinar, and we will be informing about our next webinar through email. And to all the participants who have registered with us, once again, thank you so much for attending the webinar. Have a great day. Thank you, sir.